Namaste. We take up into the series of psychoanalysis, schools integration, the innate, me before I. Integration of schools in psychoanalysis is a long cherished ideal. One way to move ahead is to start with conceptual integration on key concepts of each school. Our journey in this road will have as guide psychoanalysis consultant Mr. Himanshu Vaidya. Namaste, sir.
Namaste.
So, how do we go about in this series?
There are two ways of doing integration. One is conceptual integration. Second is integration of technique. Conceptual integration would mean, let us say you are talking about 0 to 2 years, first 2 years of life. Freud would call it the oral stage and list out what happens in the oral stage and how pathology can develop and how that has to be treated. Client will go over the same time period and bring about the paranoid schizoid and the depressive position. She would talk about how because of these two phenomena, going right or wrong, pathology can develop and how to treat. Kohut will talk about healthy self not being created in the first 2.5 or 3 years. Intense shame getting built up. Failure of mirroring and idealization and empathy. And other factors that Kohut lists out as responsible for pathology. Lacan would talk something else about the same first 2 years, and Jung would talk something else about the same 2 years. The idea is, for the same time period, each theorist is talking about some phenomena which he or she believes is important and critical to pathogenesis.
Right.
The challenge here is every school has proved itself on some group of patients. Can we integrate conceptually? Like when Freud talks about relating to the mother and the mother not responding back, leading to secondary narcissism. Can we understand that also in terms of object relations? When Freud talks about Oedipus, can we understand that phenomena that before the Oedipus happens, the paranoid schizoid and other forms of object relations also has happened, and with success or non-success of this phenomena, one is entering into the Oedipal phase. So the success or non-success of pre-Oedipal object relations already predisposes you in a certain way to being successful or not being successful in navigating the Oedipal phenomena.
Right.
So one part is phenomena of one school coexisting with phenomena of some other school. As two phenomena happening at the same time.
Same time.
Second possibility, both phenomena being involved in a larger phenomena. That there is a full phenomena which partly is described by one school, but another school also is a part of the same phenomena. And the third possibility is one phenomena predisposing you for a later phenomena.
Right.
And the two phenomena belonging to different schools. Now, all these possibilities bring up this idea of integration of schools. And this integration of schools is an ambition which has long persisted in psychoanalysis, but it has never been completely achieved. Now, when we talk of integration, We talk of integration in concept and integration in technique.
Right.
And we also then talk about integration at 3 levels. Integration between schools of psychoanalysis,
Right.
integration between schools of psychoanalysis and schools outside of psychoanalysis, but still broadly within the area of Western psychotherapy. Like you can talk about within psychoanalysis, you can talk about integrating Freud and Klein,
Right.
whatever extent you can. Between psychoanalysis and outside, you can talk about CBT and Freud, or CBT and Klein, or you can go to the Eastern area of spirituality. You can talk about Hindu psychology, Hindu spirituality. You can talk about the Tibetan schools and look at integration of them with Freud, with Klein. And of course, the grand ambition is to integrate everything into one. All schools of psychoanalysis, all schools of psychotherapy, all schools of East and West, and arrive at one grand theory of the mind, and ultimately leading you to the theory of everything within mind. And then if you are manic enough, you can expand it to mean theory of everything. Mind and non-mind all put together. Okay. So that being the ambition of the theoretical enterprise, one small step in that area is what we are doing in this series. On taking baby steps to integrate at very small levels various schools of psychoanalysis to whatever extent they can be integrated. So this is what we will do in this series of school integration discussions. And what we are doing here is we are taking an approach of timeline.
Right.
That starting from age 0 to, let us say, age 100, at various points in time, when difficulties arise, how can various schools be integrated for that purpose? And obviously,
And how?
yeah. But obviously, because, and how is very important. Not only that, which schools will be integrated conceptually, but in technique. Like when you're sitting in the therapy room, how do you integrate and put that integration into practice? Right? And because when we look at the complete life, especially in psychoanalysis, the most important part is 0 to 5 years. There are very few theorists like Erik Erikson and Carl Jung, which go on the idea of a program of life and talk about various phases of life. Most psychoanalysts focus on 0 to 5 years. So that is where our focus also will be.
Right.
And we'll try to look at how do you divide the 0 to 5 in various parts. And in each part, how do you look at various schools, what they say about each part, and how integration can be done. So in terms of the state of the knowledge, we are actually at the pre-integration stage. And this is in the light of that situation, we are taking small steps in this series. So journey of 1,000 miles begins with a single step. So this is our single step, the first step.
This is going to be a very exciting and enriching discussion, I'm pretty sure. So to start off with the concept of the innate. What is in us at birth? How does the different school, is it a blank canvas? Is it with something there? So would like to start right from the beginning.
So we start this 0 to 100 with 0. And at 0, we talk about what are we born with at 0? What is innate in us? even before the first psychological phenomena can occur in our mind, what is innate in us? And can we integrate different schools on this innate? So let us look at what different schools say. And then let us look at also why it has been so difficult till today to integrate these schools.
Absolutely.
Because there have been very good thinkers, very good integrators in the area of psychoanalysis. It's not that they were not there, but they were still not able to do it. So let us spend a few minutes on why it is so. Just let us look at this topic of the innate. Now, the moment you talk about what is innate, philosophy comes in breaking the doors. Like Freud climbed beyond the classical materialists. Later beyond you can put aside, but at least you can think about Freud and Klein and the classical psychoanalysts. They come from the philosophy of materialism. So the psychic activity essentially is a material activity, or at best it's an epiphenomenon. And therefore, they find it very difficult to deal with the idea of innate in terms of a design. Because whatever is innate, you can always put two questions to any structure. If the innate is amorphous, if the innate is a blank screen, then you don't have to answer these questions. But if the innate is not a blank screen, then whatever structure is there, you can always put two questions to it. Who created this structure? What is the purpose of this structure? So the two questions, one is the question of origin, second is the question of purpose, on two ends of that structure will always be there. And that is very uncomfortable to a materialist. Because the moment you talk about purpose and the moment you talk about origin, either you give a satisfactory explanation or you say, I don't know, in which case you are conceding half the case. And if you give an explanation, it can easily fall in the area of idealism. It can easily lead you to God. It can easily lead you to destiny. So this is a very difficult area for materialists, how to deal with the innate. So you can see how the philosophical differences,
True.
right, they make theory integration so difficult. That's one of the parts. Not that we don't have conceptual challenges, of course we have, but even the philosophical aspect makes it difficult. Let us now take a few points of what each has to say on the innate. For Freud, what was innate was the life instinct and the death instinct. What was innate was a primitive psychic apparatus. What was innate were instincts. What was innate were component instincts. Freud talks about the component instincts. The instinct for pleasure, the instinct for aggression, exhibitionism, sadism, and so on. And there is a potential program which Freud does not want to say so, but there is a potential program for psychosexual development in a particular way.
Okay.
If though that program was not innate, Freud's theory of psychosexual development would not exist. So that theory exists because there is an innate program which Freud does not talk about, because the moment you talk about it, the question of origin and purpose comes in. Okay, why only this program? And why this program only in this way? Why should the oral be followed by the anal and the phallic? Why not the other way around? Why did nature not say phallic will be number 1, oral will be number 2, and anal will be number 3? What purpose is served by this particular sequence? What purpose is served by keeping oral stage for 2 years? Why not for 2 months? So these kind of questions are difficult to answer questions. When you start asking why is what it is. So if you put the same logic to Freud's psychosexual development, you come up with the same questions. Why only these 3 stages? Why only the same length of duration? Why only particular ages? Why not the third coming first and the first coming second? So this is what Freud says about the innate, that innately we also have a mind which is working on reality and fantasy. And Freud also talks about the oceanic state right after birth, after which the object relation stage starts. So for Freud, this is the innate.
Okay.
For Klein, apart from all of this, the unconscious fantasy life, not only the conscious fantasy life, but the unconscious fantasy life also is innate. For Klein, object relations is innate. Guilt is innate, very different from for Freud. For Freud, guilt was the creation at the end of the Oedipal resolution. But for Klein, it was inborn. So for Klein, there were certain more things which were innate compared to Freud.
Right.
And what was innate for Klein was the shift in positions, and they were not stages. The paranoid, schizoid, and the depressive positions would be lifelong there. So this for Klein was innate. For Winnicott and beyond, it was innate to search for good mothering relations, to search for good containment, to search for a safe environment where one can live out your true self. It was innate for Winnicott that there would be a search, there would be a push to live out one's true self. For beyond, it was innate to search for containers. Not only passive containers, but active positive containers. Containers which can facilitate the happening of O, the ineffable O. For Kohut, what was innate was search for mirroring and idealization and empathy. The search for attention, acceptance, affection, admiration, attachment, all of this was innate. The search for fame and slide into shame if it does not come your way. For Jung, what was innate was the self, the collective unconscious, the archetypes, and the program of life. It was innate to Jung. So these things were innate according to different theories. So even the moment you are born, the disputes already are there. Right? Even before the first phenomena gets analyzed, what is innate, there are disputes, and therefore there is a enriching reason if we can integrate as many schools as we can on this point of the innate, which will come to a little later. But one interesting part of what is innate between Freud and Klein was very interesting.
Exactly.
For Freud, the first oceanic state of primary narcissism had to happen before object relations, but for Klein, object relations were innate. So they were differing on what this is even in terms of their innate. So we see various schools talking about the innate in many different ways, and therefore the need for integration and enrichment.
So can we spend some more reflection of on object orientation and, as you mentioned, primary narcissism?
Now, this is a very important difference between the Freudian school and the object relation school. Freud believed, and quite strongly, that after birth, for some time, the child experiences an oceanic state. This is a state where I and not I does not exist, not only in the external world, but even not in the internal world. Now, this is a very important difference between Freud and Klein. Klein believed, as do most object relations theorists, that the psychic activity happens only with objects as entities, which means our cognition and our affect always involves some object. There is nothing like thinking without object. There is nothing like a feeling without an object. The feeling always is towards an object. And by object, we mean not only people, but any object in the internal world. So Klein talks about object representations, that there is an internal world where all outer objects are represented. And towards these representations, the affect moves, the cognition moves. But cognition and affect are very goal-oriented entities. They move always towards objects. They involve objects. And if the objects are not available from the external world, our fantasy creates objects. So we are object relating people and we are object creators. If object deficit happens in the external world, we make it up by fantasy.
Right.
So for Freud, there was a pre-object stage, after which the object relations begins. And for Klein, there is nothing like a pre-object state. We always have object relations. Recent experiments lean more towards Klein, that even in earliest of children, they see from outside at least object relations of some sort. But I believe that Freud was right, despite all the experimental findings. And therefore, the oceanic state is very important. And this oceanic state of experience happens in spirituality also. The state of samadhi in Hindu spirituality and in many Buddhist schools, the state of nirvana, the state of being lean in the Brahma, the state of enlightenment, variously called, is an oceanic state. The difference is Freud's oceanic state is before the ego is fully formed, whereas a spiritual state is after ego has been transcended. So the ego does not disintegrate, it is deactivated. And when the person comes back into the normal state of object relations, the same ego starts becoming active again. It is not, and the ego disintegration is not there, it's deactivation. It's a mastery, it's a transcendence. So the oceanic state of the enlightened person is very different from the oceanic state of a child. But what is common is it is a state where I and not I does not exist actively. So I believe that if we try to integrate the two schools on this particular point, what we may have to do is this: convert Freud's stage into temporal states. That maybe it may not be that first 3 weeks one is into primary narcissism. Maybe object relations and primary narcissism both coexist. For some hours, we experience primary narcissism, and for some hours, maybe we experience object relations. And this is borne out by regression of certain groups of people suffering from negative symptoms of psychosis, where we can see they are very happy in that regression. I call it happy psychosis. And you often see extreme fragile narcissism accompanied by a partial ecstasy, which keeps calling them back to that pre-object stage as much as they can go. So we can see
Can
the
you repeat that,
fixation.
sir?
Sorry?
Can you repeat the last line?
We can see in that group negative symptoms of psychosis. One does not want to
Right.
deal with objects in the external world. There is a regression to that state of primary narcissism where they experienced ecstasy or bliss, and we can see that they minimize interaction with the world, they minimize object relations, they go back
Right.
to that state, and we can see them very happy
Happy.
despite the psychosis and all the practical problems it brings. And that bliss, almost an orgasmic bliss in some sense, is what I would refer to as the bliss at the breast. But it is not bliss at the breast exactly, because bliss at the breast still is an object relations phenomenon.
Object. True.
But a more intense form of that, which is in the form of primary narcissism. So we see that regression in psychosis to the state of primary narcissism. So even if that state is not a complete stage, there is no doubt that there is a distinct experience of primary narcissism, if not as a stage, then at least as a state in that stage. That maybe in that stage of first 2 years, there are hours of primary narcissism and there are hours of object relations. Or maybe in the first few days, there are more hours of primary narcissism, and maybe after some time, there are more hours of object relations. So this is one way of integrating the two on this point.
So how about the cohorts innate?
Cohorts innate brings in the element of mirroring, the 5 A's we talked about: acknowledgement, acceptance, affection, admiration, attachment. So Kohut talks about narcissism being innate. For Kohut, narcissism and exhibitionism are innate. And we pass through these phases naturally, where we get into exhibitionism and narcissism, and we expect others to admire. And if that is not forthcoming, it results in shame. So which means the movement on fame to shame continuum is also innate. So for Kohut, narcissism as a developmental state, exhibitionism as a developmental state, mirroring and empathy and idealization as developmental states, and moving on the continuum of fame to shame as an innate developmental state. These all are innate. And obviously they are happening at the same time, what Freud will call as the oral stage.
Right.
So in the 0 to 2 or 0 to 3, a lot of things are happening. We will see to it when we go to the oral stage. But this is what is innate according to Kohut.
So it brings us to the aspect of innate that is transpersonal.
Yeah. Now this creates another element of what all can be innate. Because till now we have taken the materialist point of view of what all is innate by the strictest materialist standards. Now, if you bring in two more elements of Jung's element of collective unconscious, then that is also innate according to Jung. If you bring in the element of intergenerational, which is now a scientific concept, that traumas, difficult emotions, difficult templates can be passed from one generation to other, then that also is innate. If you bring in a larger, slightly larger view, a more liberal view, then transmission from culture and history also would be innate. Some part of it will be there. And the appreciation of the big other, as Lacan calls it, also partly is innate. So these other elements are also innate if you slightly widen the horizon, if you widen the filter and allow these things to pass through, then this also add to the list of all that is innate.
Can constitution and archetype be also innate?
Yeah, true. That is the Jungian innate.
Jungian. So when we talk about integration, how can integration be imagined on this aspect?
Take each of Freud's stages and look at apply object relations, how they happen in each of the stages.
Right.
And you can integrate it to some extent. Two, look at what happens in the paranoid schizoid position and apply that to subsequent stages. So what happens from a Kleinian sense in the oral stage and how it affects the anal and the phallic stage.
Phallic stage.
Third, what happens to component instincts? Take the reverse of it. What happens to component instincts in paranoid schizoid state? How are the component instincts behaving? When we talk of object relations, one specific form of object relations would be the type of object relations referred to by Kohut, Winnicott, and beyond. They are referring to object relations, but specific type of object relations. So Clark just talks about object relations. Now, if you break this into various things, various types of object relations, now some type is what Kohut refers to, some type what Winnicott refers to. In that sense, Klein was a generalist. She did not go into the classification of types of object relations. And then we have ego and self-definition. That if we go into Kohutian part and bring in the element of self, we'll have to redefine the ego.
Ego.
The Freudian ego will have to redefine to integrate Kohut's self with the Freud structure. And I have done that by dividing ego into a system ego and a social ego. That is how the two can be brought together. And then when we look at the program of life of Jung and we look at the stages of Freud, we can look at how archetypes play a role in unfolding of the psychosexual development.
Right.
And this is how we can try to slowly integrate things. And it has not been done mostly because the clarity, openness, creativity, and this depth was not present. It's not easy to be found in theories. So what we are trying to do is to close the open spaces, whatever we can, and where we cannot, leave it open for the time being.
Very interesting and fascinating discussion it is for me. Hope it was equally rewarding for you. We meet you in the second part of the same series. See you all again. Namaste.
Namaste.